Healthcare at New Jersey Immigrant Jail is substandard, watchdog groups say. Nelson Fernandez and his daughter Jennifer were still asleep when agents from United States Immigration and Customs Enforcement knocked at their door early one morning 2 years ago. The next minutes were a terrifying blur to Miss Fernandez, a United States citizen, who recalls armed agents swarming through their small Manhattan apartment and taking away her father, who is disabled by a rare autoimmune disorder and dependent on blood thinners to prevent fatal clots. Mr. Fernandez, a legal permanent resident for 26 years, suddenly was facing deportation to the Dominican Republic, based on a 1992 drug conviction for which he had already served probation. He was not facing new criminal charges. But like thousands of New Yorkers held annually in immigration detention, he was taken to a county jail under contract to federal immigration authorities, the Hudson County Correctional Facility in Kearny, New Jersey. There, unable to contact his family, he was soon bleeding internally and pleading for medical care. Mr. Fernandez's case is one of 61 described as part of a pattern of substandard medical care at Hudson in a civil rights complaint filed on Tuesday with the Department of Homeland Security. The administrative complaint, brought by two citizens' coalitions that monitor conditions in immigration detention sites across the country, urges federal authorities to immediately intervene to ensure the health and safety of current and future immigrants detained at Hudson, either by ending its contract with the jail, which is paid $110 a day for each detainee, or appointing an independent investigator to swiftly inspect and improve the jail's healthcare policies and practices. The 8-page complaint, a last attempt to seek an administrative remedy before a lawsuit can be filed, describes Hudson as one of the 3 worst detention sites among 53 monitored by the coalitions, Community Initiatives for Visiting Immigrants in Confinement, known as CIVIC, and First Friends of NJNY. The groups noted that the private health care provider at the Hudson Jail, CFG Health Systems, is seeking a 5-year contract renewal at a cost of $29.4 million, to be voted on in 2 weeks by the Hudson County Board of Chosen Freeholders. They urged the board to meet with advocates to discuss the complaint before that vote. Other cases cited in the complaint include a Queens man with a brain tumor taken into custody before his scheduled surgery, who suffered worsening headaches, dizziness and seizures for nearly 4 months before advocates succeeded in winning his release. The man, Claude Elder, 36, now fighting deportation to Haiti, said in an interview that jail healthcare employees denied him the medication he had been taking to shrink the tumor, saying it was too expensive. A jail spokesman declined to comment on the complaints, saying detainees were a federal responsibility. CFG Health Systems did not respond to several messages seeking comment. To advocates, the very nature of these complaints underscores how little has changed since 2009, when the Obama administration announced an ambitious overhaul of the immigration detention system, garnering front-page headlines. The system, a hodgepodge of local jails and for-profit prisons, had come under fire for mistreatment of detainees and substandard medical care that sometimes ended in detainees' deaths. The administration promised to establish a truly civil detention system under more direct federal oversight. The egregious conditions still continue, said Sally Pill, program director for First Friends. I think ICE really has to be accountable here.